Hello, my name's Hayley Payne and I'm a Programme Manager for Children and Young People's Mental Health at NHS Gloucestershire Integrated Care Board. And I'm just going to go through my experience of how commissioning feels across different sectors, different services, and that sort of strategic view of our experiences really in Gloucestershire. So obviously the whole thing with commissioning, working with providers, it's all about relationships. That's the biggest thing really to get right. And what I've put there's sort of, when I started my journey within working with CAMS on their transformation programme, my job title then was Senior Commissioning Manager. And even that I thought, actually, if I'm trying to build relationships, having commissioning in my job title probably isn't the best way to go. So I changed it to a programme manager. And even with that change, it made a huge difference to the way that people engaged with me, their sort of initial sort of thoughts about what I'm there to do changed. So it's fantastic. And I even had an honorary contract with our mental health trust, again, just to sort of break down those barriers really and sort of improve those relationships. All of our project teams are joint. We have representation across the whole mental health system, again, sharing those ideas and sort of sharing the work out really. Having that shared vision, having those shared goals, it's vitally important. And as I've said, they're shared outcomes and risks. It's not all going to go to plan, and you just hold that risk together rather than putting it on one particular organisation. As part of our transformation programme, we reviewed the KPIs and really looked at them and thought, actually, are these helpful? It's the so what question for me. So we can collect the data, but what difference is that making to young people in our county? So obviously some of them we have the national sort of mandated ones, but others we really sort of reviewed and thought, actually, are these achieving the goals that we want them to? And if not, why have we got them there? Why don't we put something else in that's going to help this service to transform, help the children and people in Gloucestershire? And as I've said, building that trust and sharing issues, be open and honest and transparent as possible. If a service is coming to you and showing their true weights, don't penalise them for it. Actually sort of sit and really talk through the issues and sort of try and work out solutions together. So that's sort of across the system. And now I'll sort of talk about a particular case study in Gloucestershire where we've called it One Front Door. So it's like a single point of access. We've called it our multi-agency navigation hub. So a lot of the feedback that we had from children and young people, families, professionals, providers across the system was that it's not a clear process of where a young person would have to go for support. Young people and families feel like they're ping-ponged around the system. They get referred here, they get rejected, they then get referred here, again, signposted somewhere. It's ping-ponging around, no one's holding them. So we work with our partners across all agencies, so with CAMS, with our voluntary sector, and with education inclusion. We've built really good links with our local councils, with education, with inclusion, because we realise quite quickly that the young people that are at the risk of exclusion or not engaging with education are probably the same people that are sat on our waiting list for mental health support. So we joined forces and we sat and we worked out how could we have one single front door for any young person to be referred into with either a mental health and emotional wellbeing needs, they've got a risk of exclusion or need support to re-enter school system, they need some of that early help support for their families and for that young person as soon as the problems begin to emerge. So we pulled together a steering group and we worked across, as we say, multi-agencies, including social care, and sort of really began to sort of map out what that sort of single front door functions need to be. So at the moment, we are about to pilot that approach at the end of the month, where we will have processing requests for support, so that triage function. But also it was really important for, again, those families to feel heard and feel listened to and held. So we will be employing some outcome support managers to be contacting that family, having that discussion with them about what's important to them and sort of trying to make it as personalised approach as possible. So I've done another slide on just to give that range of stakeholders, and of course you'll notice that within this we haven't included some of our main stakeholders, the most important, which is the children, young people and families, but that just gives the range of sort of providers and sort of professionals that we are working with in this, so huge range. And together, again, you need those shared objectives, so we sort of, you know, work together on what should our project objectives be. Obviously decision support, so enabling that joined up working. Productivity, again, so much replication in the system. We need to streamline those requests to allow services to have the capacity to actually sort of treat these young people rather than siphoning through the hundreds of referrals that each service is getting. User experience is a huge one, obviously. We want to improve the experience for families and young people so they don't feel that they're being, as I say, ping-ponged is our favourite word, around the system, so being rejected and passed from service to service. And just improving that efficiency overall, working together. We're already working with these children in our separate services. Let's come together and really utilise that sort of multi-agency approach. So what it's been like so far, huge successes is the fact that all our agencies are on board right across the system. Fantastic. They all agree. They can all see that our shared vision is there, what our goals should be. We've got schools and one of our primary care networks engaged for the pilot, which is fantastic. And we've got our effective governance in place. So we've made sure that obviously all our IG is in place and that it's been signed off by our boards. But the challenges, as you can imagine, is capacity around the services. Because this is a pilot, we're asking services to almost double up in their processes and to try and spare sort of some of their capacity to put into our navigation hub. So that's been a challenge to get everybody's agreement for that. They all think it's a good idea, but actually in practice, what does that look like? And our data recording, as we know, not all of our systems talk to each other, so we have to make sure again that it's safe, that children and people are being recorded in the right way, and that it can flow up to the mental health data set, so we're capturing those access targets as well. But all in all, a really exciting project. It's been fantastic to work on. I can't wait to see how it goes. And you know, in terms of working across the system, it's probably the most innovative one that we've done, including our colleagues in our county council and education. It's been fantastic. And that's it. Thank you for listening to me. Please do get into contact with me if you have any questions. I'd be more than happy to answer them. Thank you.